Okay, so we talked about the perception of pain and pain for muscles and joints, referred pain, and anti-nociception for controlling pain. The last part of this section is going to be short and sweet, and we're going to talk about nociceptive chronic pain. So, nociceptive chronic pain is chronic pain that is due to continuing stimulation of nociceptive receptors. So an example of this might be chronic pain that results from a spine tumor pressing on nociceptors in the meninges surrounding the spinal cord. So the neurons are functioning normally. The chemical changes in damaged tissue awaken the sleeping peripheral nociceptors. But this is what our nociceptors are supposed to do when there's the potential for tissue damage or actual tissue damage going on. So in nociceptive chronic pain, the neurons are functioning normally. It's not going to change until that tissue damage is removed. So remove the tumor or relieve that pressure in some other way. So usually it's surgery or radiation or chemotherapy, something like that. So you're not going to get rid of it from regular pain control mechanisms. Primary hyperalgesia refers to excessive sensitivity to stimuli in injured tissue. So have you ever gotten a sunburn and you feel like, okay, it's going away, I'm feeling pretty good, and then you get in a hot shower and you're like, it's really painful. So the pain resulting from the mild heat in that previously burned skin, that's primary hyperalgesia. The nociceptors are excessively sensitive. So the example that is given here, that's given in the book, you burn your fingertip and then picking up something hot is more painful than if the skin weren't injured. Nociceptive chronic pain serves a useful biological function as a warning to protect the injured tissue. So it totally makes sense. The thing that we see a lot in a therapy setting is after surgery, people have inflammation, their injured tissue is excessively sensitive to stimuli that wouldn't necessarily normally be painful. A lot of people after knee surgery or something will say that they just can't stand the sheet or blanket being on their knee, or even their clothes. They'll wear shorts so their pants don't touch that sensitized tissue. So this does serve a useful biological function as a warning to protect the injured tissue. So when we start talking about neuropathic chronic pain is not normal. It does not serve a useful biological function.